Okay, members, we'll now move on to questions to the Minister of Health, and I call Liz Kimmins.
Question 1, please.
Thank the member for her question. The evidence available demonstrates that the healthcare courses commissioned are attractive under the current support arrangements. Our local universities report very low attrition rates out of these courses, and historically all have been heavily oversubscribed, a position which actually increased even further for 2021 entry. In terms of individual courses, my department provides the following support. For eligible nursing and midwifery students on commission courses from Queen's University of Belfast and Ulster University, they receive a non-means tested bursary of £5,165 per annum, £430 per month. They may also be eligible for a range of means tested and non-means tested bursary elements. Students on commissioned allied health professional courses from the Ulster University, and that includes our new paramedic science, Bachelor of Science, which welcomed its first cohort of students in September 2021, have their tuition fees paid by the department for the duration of the course. Students may also be able to access a range of means and non-means tested maintenance grants and loans available through the Student Loan Company, and that's subject to meeting the relevant criteria. In relation to medical and dental students, NI domiciled students undertaking their studies at a UK medical or dental school are provided with tuition fee support and may also be eligible for grants towards their living and travel costs on entering the 5th year of a first-degree course in medicine or dentistry. Support may also be available to medical students undertaking a 1-year intercalculated degree as part of their undergraduate degree course. Social work students receive financial support through the Department's Student Incentive Scheme, which provides eligible students with an annual payment of £4,000 and an allowance of £500 towards travel costs, and that's associated with practice placements. The Department also pays tuition fees of up to 20 students per year on a 2-year Masters of Science in Physician Associated Studies in Ulster University. And while these support arrangements across all these healthcare programmes commissioned by my department are kept under continuous review, the evidence is that the current support arrangements appear to be effective in attracting and retaining good quality students.
Supplementary, Liz Kimmins.
I thank the Minister for his answer. Minister, I'm sure you will agree that healthcare students have played a vital role in the battle against COVID, putting themselves in the front line for little or no recognition or reward. So if ever there was a time that was right for a review into bursaries and financial supports offered to our students, such as midwives, student nurses, medical students and all of our healthcare students, I think it's now. And whilst you have listed the supports that are currently available, the experiences of students, what we're hearing, it doesn't reflect that. So, Minister, I'd ask you, will you therefore send a clear message to the future key workers within the health service that they are valued and worthy of proper support and investment by initiating such a review?
No, and I thank the member for her point, and I think we have taken steps during the early stages of the pandemic in actually recognising the students who did come forward in regards to a £2,000 payment, in regards to some of the work that they did do and placements they are aware. But I think the key question of where the member is actually around the National Union of Students and their support students. I think it's the Health for Heroes campaign they've actually started. So I'm aware of the ongoing campaign by the NUS and the calls for support. I'm also aware that I've received correspondence from NUS USI and from MLAs on this matter, and I note the important issues raised by this campaign, and I will provide a detailed response in due course. And I think it was the chair of the Health Committee invited me to meet them at one stage last week, and I've agreed to do that.
McLaughlin.
Mr. Speaker, is the Minister aware that some of the financial assistance available can actually inhibit students to apply for student loan and grants as income is actually taken into consideration? Will the Minister please look into this?
In regards to student loan and grants, actually falls under the Department of the Economy in the broad scheme of things, but there is a close working relationship between my department and the Department of Economy, especially in how we support medical students, and the member will be aware as well in regards to the additional places that we have put in Magee in regards to the medical school up there, and I'm content that we continue to actually support that graduate entry medicine courses in Magee, so that we can supply a future supply pool of not just doctors but also GPs, especially for the West as well.
Call Alan Chambers.
Thank you, Mr. Speaker. How much of an impact does the Minister believe one of his first achievements of delivering 300 more student nurses and midwives a year for 3 years will have in making a real difference to tackling the workforce challenges that we've been facing for so long?
And I thank the member for his question. It will make a difference, but we have to wait for them coming actually through their training and then coming out the other side of their courses as well. So we won't see the real benefit for another 16 to 18 months. And then those 3 years of the additional places of 1,325 nursing student places in Northern Ireland per year, I think will have a great impact on our workforce in nursing, not just in regards of making up for the shortfall that we've seen over the last number of years when those courses were actually, and those numbers were actually cut, but also receiving that additional boost and bolster for the current workforce, where they'll actually see that as a real morale drive when they actually see that new entry coming into what is a key profession, which I think is an important profession, I think one that we should support.
Call Stuart Dixon.
Mr Speaker, thank you, Minister, for your answer so far. Minister, you've already answered a question in relation to payments to students, nurses and other medical and allied professions. But Minister, a lot of time is spent by MLAs dealing with what might be described as the ping-pong between the Department of Health and the Department of the Economy when it comes to supporting students, both with finance and also with student numbers. So, Minister, can you, and welcome the numbers of student nurses that you provided, but can the Minister set out a clear plan going into the future to deliver the whole cadre of professional medical students going forward in Northern Ireland, and that there will be a clear pathway in terms of their financing?
No, and I thank the member for his point, and it's an important one because it's not that long ago I remember the same conversations around student teachers, where there was, the ask come forward from the Department of Education, but it's the Department of Economy or Employment and Learning at that point in time that was actually commissioning trading places. So there is actually a close working relationship, especially when it comes to medical placements between the Department of the Economy and my department, and how we best make sure those courses are actually placed, but also financially supported as well. And there is a review going on in Ulster University about the placement of those students, and I think it's critical that we actually make sure we place those courses and those students in the right place, so that they not only get the teaching that they need, but they also get access to practice. Because one of the limiting factors in regards to even the 300 nursing training places that we've commissioned over the last number of years was actually not just the classroom time, but actually making sure they get into hospitals, they get into placement, to get that practical experience as well, because their courses are made up of both parts as well.
Call Keith Buchanan.
Mr Speaker, question 2, please.
I thank the member for his question. The Northern Trust Breast Care Services provides both a screening and symptomatic service, and that encompasses the specialist care for patients with breast cancer and non-cancer conditions. The Trust continues to receive a high volume of referrals, with every effort being made to see patients as soon as possible. A range of actions have been implemented to alleviate pressures on services in the Northern Trust and have already made a significant impact. These actions include the Enhanced Care Response Team pilot, which has had a positive impact in reducing ED attendances and avoiding omissions, the provision of additional breast screening clinics and a decrease in appointment times. These actions have already made a significant impact in the Northern Trust breast cancer services. While the November 2021 figures highlight there were 697 patients awaiting breast screening as part of the 3-year breast screening programme, the length of delay is down from 5 months in September 2020. Additional screening clinics are also planned for this month and next. The Northern Trust is working with the Health and Social Care Board and regional colleagues to ensure equity of access across the region. The breast screening mobile units move across the Northern Trust area in a set sequence so that women do not have to travel out of their area for their scan. I can also say that there has been no delay to the high-risk breast cancer screening programme, and in addition, the Northern Trust breast 14-day waiting time performance standards were 18% in April, and these have increased to 100% in July and 92% of August in this year. The member will be aware that the 14-day target was being widely breached even before the pandemic.
Keith Buchanan, supplementary.
Mr Speaker, and thank you, the Minister for answering so far. Minister, obviously any suspected cancer is very traumatic for the individual or the family involved, and I appreciate your answer regarding to the waiting times. So are you content now that whenever a patient is red flagged by a GP, that they'll be seen in a timely manner, irrespective of its breast cancer, indeed any cancer?
And I thank the member for his point, because it actually is a crucial one that we get to, and the member will be fully aware of the additional services, the additional energy and the additional commitment that our health service has really shown over the past 20 months in regards to making sure that all patients are seen as quickly and as efficiently as possible. And the interaction that we see now between primary care and secondary care has actually been one of the things that has improved during the pandemic. When I first took up this post, attending, I visited hospitals, I visited with GPs, and one of the biggest frustrations that they talked about was the dear colleague letter, was when those in primary care were actually writing to their secondary care colleagues and they didn't know who exactly they were talking to. Because of the better interaction, the better communications we've seen due to the pressures of the pandemic, there's a lot more better communication and interaction between now primary care and secondary care to make sure our patients get seen as quickly and as effectively as possible. The member will also be aware of our cancer strategy that we have published, and I'm thankful that the Minister of Finance has indicated that the forthcoming budget will see that funded in its full.
Colin McGrath.
Mr. Speaker, and I thank the Minister for his answers so far on this issue, which is very, very important. And one of the best ways to challenge and tackle issues is to know exactly the scope of the problem. I had recently written to the Minister and asked about how many people have been diagnosed with secondary breast cancer over the last number of years, and was told that the department doesn't hold that figure. Would the Minister undertake to try and address that, so that we can work out exactly how big a scale the problem is, so that we can then undertake a proper way to tackle and deal with it?
And again, I thank the member. I'm aware he has written these number of AQs in, which I apologise, we are getting round to answering for the member on those specifics. In regards to that better correlation of data across the entirety of the health service, that's exactly what the Encompass programme, our new digitalisation of all our records, is actually meant to serve. And again, we need the investment and not the long-term strategic investment, so we can get read across not just all trusts, but also primary care to secondary care, but also so we can identify patients where they are having to come back for additional treatments related to the initial diagnosis, or actually services that they do need to access as well. So again, it's about really updating the data capture management systems that we have within the current system. So Encompass will allow us to do that once it is implemented, but also in regards to the cancer strategy, which I referred to in an earlier answer as well, it's important that we have that core data, that we can best target services, treatments, but also see where we could be doing more as well.
Liz Kimmins.
I thank the Minister for his answer so far. Minister, you've mentioned there around the data collection, and you recently indicated that you are satisfied that the data collection on metastatic cancer would be dealt with as part of the 10-year cancer strategy. However, many constituents have contacted me citing best practice elsewhere. So can I ask you, Minister, are you prepared to reconsider your decision on joining the National Metastatic Breast Cancer Audit?
I thank the member for the point in regards to the national audit. Our cancer strategy does lay out a train of work in regards to what we want to do, and it's making sure that we have the systems in place that should we join that audit, that we actually have the ability to capture data, and we're not feeding false information into what is a very important piece of work. So I'll refer to the member in regards to the work that we want to do under the cancer strategy, but also the streamlining of processes and data capture that Encompass will enable us to do, so that when there comes a national audit or even a regional audit that we want to do, that we have that ability to actually pull down the data for patients specifically to them.
Deborah Erskine.
Mr. Speaker, breast cancer services are very important, and I don't want to take away from that. However, another issue that is affecting women is gynae issues such as endometriosis and awaiting urgent surgery. They're repeatedly told that it cannot go ahead due to COVID pressures on surgical wards, and as a result, the Western Trust in my own constituency has lost its accreditation. Can I ask the Minister that in the absence of the BSGE accredited surgery taking place in Northern Ireland, why women here are not being referred to other BSGE centres in other jurisdictions?
I thank the member for the point, and she will be aware of the regional prioritisation operational group that I established, so that we can make sure that we're looking at patients on waiting lists across the entirety of Northern Ireland rather than just in specific trusts. And I'm aware of the current issue in the Western Trust in regards to to the specific service that she has mentioned. But it really is about the regionalisation of our health service, so there isn't inequalities across different trusts as well. The member will also be aware under our elective care strategy, which we published in June of this year as well, in regards to making sure that we utilise not just the capacity that we have here in Northern Ireland, but we also look outside the region as well, so that if we have the ability to utilise other services outside Northern Ireland, that we actually do that as well. But one of the things, and the member will be aware too, that as we see the additional pressures on our waiting lists due to COVID, that's been replicated in other regions as well, so that the spare capacity that we're able to tap into or able to purchase isn't as readily available or as large as it had been in the past, or we'd like it to be.
I call Trevor Clark.
Question number 3.
With your permission, Mr. Speaker, I'll join question 3 with question 6 and ask maybe for slightly a bit of additional time. The leadership of the COVID-19 vaccination programme in my department hold weekly meetings with both Trust and GP representatives. These meetings afford the opportunity to identify and address the most pressing needs faced by both primary and secondary care in delivering the programme. To assist primary care vaccinators have been provided on request to ensure that COVID-19 vaccination clinics can be held. To date, 139 GP practices have requested 1,626 vaccinators to support 953 sessions. Since the outset of the booster programme, supporting vaccinators have worked over 8,000 hours to assist GPs delivering the booster programme. In addition to this, and to help with the updating of the vaccine management system, 38 admin support personnel have been provided to assist GPs with the administration of the programme. These staff have been trained on the use of the vaccine management system, and the governance arrangements have been updated. This resource will be mobilised to help practices with additional administrative support needs. A second workforce appeal for vaccinators is currently in place, and to date there have been 230 applicants for the Band 5 positions and 283 applicants for the Band 4 position. That's a total of 513 potential additional vaccinators, and arrangements have been put in place for those applicants, and so to process the HR processes will be undertaken as quickly as possible. And once appointed, these vaccinators will be available to assist the trusts, GPs and community pharmacies where necessary in delivering the vaccination programme.
Trevor Clark, supplementary.
Can I thank the Minister for that answer, and can I acknowledge the work that many of the GPs are doing in terms of delivering the programme? However, I'm sure the Minister is aware of the disparity across the GP services. Indeed, we hear of some people queuing in car parks to get their vaccinations, some getting it in through the car windows, and there seems to be a common theme that many of these people are not allowed into the GP practices. Is your Department Minister doing anything in relation to that to bring some sort of continuity about how it's delivered? And given these people are the most vulnerable in society, I'm sure you would agree with me that it's not acceptable for people to stand in long queues outside waiting to get into buildings to have their vaccinations passed on.
I thank the member for his question. In regards to the specific access for GPs, I do know they were up until very recently running by appointment clinics for vaccinations. Recently, and soon they will be opened up to bringing forward people just for walk-in vaccinations, so we can really get the booster programme accelerated as well. The examples the member has given, I am aware of some of those practices operating drive-through, utilising car parks to deliver vaccines as well, and that was really about getting as many through as quickly as possible, because that's what the real drive is currently, to make sure that we can get as many people receiving their booster dose as soon as is practically possible. And I want to thank the GPs, community pharmacy and their trust vaccinators to really stepping up, and in the engagements we've had actually just during the past weekend about the additional steps that I hope to announce soon in regards to how that will actually see a further enhancement of that delivery.
I call Colin Gillernew.
And thank the Minister for his answer to the questions, and I note the numbers discussed. However, Minister, given the current chronic understaffing problem within health and social care, are there, and the fact that this could add further pressure, and indeed the pressure has increased again since even these questions were formulated around Omicron, are there any plans to train staff from outside the core health and social care workforce to provide help with that vaccination programme?
And I think the member, not only are we exploring about how we train those additional staff, but the member will be aware that during the establishment and the standing up of some of our mass vaccination centres, we were using dentists, we were using vets, we were using community pharmacy, we were using anybody that would come forward and take up that additional training as well. We're also currently exploring the utilisation of medical students who can come forward and actually support our vaccination teams as well. And at this point in time, we're also considering drafting a further MACA so that we can seek support from the Ministry of Defence in regards to bringing in not just further vaccinators but also logistical support if necessary as well. And the member will be aware that there's been a number of meetings happening between my department, GPs, community pharmacy and trust officials over the weekend in regards to how we really take that next big step to get as many people vaccinated and provided with the booster over the next few weeks as we possibly can.
Call Rosemary Barton.
Thank you, Mr. Speaker. Thank you, Minister, for your answers so far. Minister, even though we may be a week or two behind many other parts of the United Kingdom in terms of spread of the Omicron variant, can you confirm that Northern Ireland's vaccination and booster efforts over the next fortnight will still be taken on with equal vigour and pace?
And I thank the member for that point. I don't think it'll just be taken under with equal vigour. I think we've already seen a stepping up of that programme. We're able to announce walk-ins for the over 30s, and we're already seeing sites where, unfortunately, we're seeing more people turn up than we actually have capacity in regards to that. So I'd ask people just to make sure and look to social media and look to trusts, information sites to make sure that they do get the most up-to-date data in regards to when walk-ins will actually be available at those trust sites, but also to explore community pharmacy and GPs as options. To put things into perspective, within the last week we've delivered over 100,000 vaccinations, including boosters, and that's averaging around 13,000 per day, which would be well up there in regards to when our vaccine programme was running at its most efficient. But we are actually catching up now in regards to where there was a difference between us and other regions of the United Kingdom, and between today and since the 1st of November, we've actually seen an increase of 3.3% in regards to those coming forward, for those who are eligible coming forward for their vaccination, and that far outstrips anywhere else.
Call Paula Bradshaw.
Thank you, Mr. Speaker, and thank you, Minister, for the update in relation to this. And I welcome the speeding up and ramping up of the vaccination programme. But, Minister, could you please provide some clarity for those people who are housebound who received their vaccine in the first round from their GP or a district nurse? Thank you.
I thank the member for that point as well, because again she will be aware at the beginning we concentrated our programme in regards to those who were in care homes, but also those housebound who were housebound as well. And our trust continue to work closely with our GP colleagues who are responsible for identifying housebound patients. Prescribing the vaccine and administration is then coordinated by GP-aligned district nursing teams. COVID-19 vaccination has been and remains a priority for trust teams who have supported the actual wider vaccination programme to date. And total to date, housebound boosters administered by trusts is 2,653, but GPs also administer a small number of vaccines to their housebound patients directly, for example, if they're attending their home actually for a clinical assessment.
I call Mervyn Story.
Question number 4, Mr. Speaker.
Thank the member for his question. The planning and design for the refurbishment of the Robinson Memorial Hospital is progressing well, and the implementation plan is being finalised. The refurbishment will reconfigure the existing footprint of the hospital to provide 16 inpatient beds, which will be made up of 6 single bedrooms complete with ensuite facilities, 1 2-bedded room complete with ensuite facilities, and 2 4-bedded gender-specific wards complete with ensuite facilities. The hospital will also undergo extensive updating throughout, improving storage areas, office accommodation and all patient areas. Works are due to commence in April 2022, and we think will take a period of up to 6 months.
Robin Story, supplementary.
Thank you, Mr. Speaker, and thank the Minister for his answer. And obviously, what he has said is welcome news. It is disappointing, however, that the funding of this has had to come solely from the Robinson Memorial Charitable Trust. And given the fact that we have 88 years of the existence of the Robinson Hospital, I think that clearly is an indication of their commitment in terms of the trust. But would the Minister give an assurance that with all the talk that there is about the reconfiguration of health services and all the change that he anticipates will come in the years ahead, particularly following on from the recommendations of Bengoa, that there is a future for the Robinson Hospital in the healthcare provision in my constituency?
I thank the member for his point in regards just to the importance that the Robinson Hospital actually makes in our constituency in regards to the provisions that it does. And the member will be well aware that I've often said from this place that we now need every square foot of our health estate, and that's why I do welcome, like him, the refurbishment and the upgrading of the Robinson Hospital, because I think it shows an indication of the commitment to the future of that hospital, something that actually wasn't present a number of years ago when we looked at the reconfiguration of provisions across Northern Ireland. The business case for the refurbishment is actually set at £2.2 million, and therefore the investment is subject to change following tender returns. And as the member indicates, the cost of the refurbishment is being met primarily by Trust charitable funds and funds from the Robinson Board of Trustees. And the Robinson Board of Trustees takes a keen interest, as the member said, in the strategic development of the hospital and the site. And I welcome the fact that the Robinson Board and the Trust endeavour to work in partnership to enhance the site for the benefit of the community and actually future-proof the Robinson Hospital.
I call to Minister.
I welcome the indication of progress in this matter. It's something that I think has been discussed almost every year since I arrived in this House, so it's good to hear some progress. But and I do salute the Charitable Trust who've really got this moving. Could the Minister tell us what, if any, actual public money is going into this project which will meet a public demand?
The member will be aware of how the Robinson Trust is actually constructed in regards to that. And as I said to the earlier member, the cost of the refurbishment is being met primarily by Trust charitable funds and the funds from the Robinson Board of Trustees. So in regards to the specifics, I'll have to get back to the member with an exact figure. But from my briefing here, it is being met by the Trust charitable funds and funds from the Robinson Board of Trustees.
Annie Murphy.
Can Collier, Minister, since becoming an MLA, my priority has been to deliver first-class services for my constituents in Fermanagh and South Tyrone. Therefore, I was delighted that the business case for the Lissinsky Health Centre was signed off on last week. Minister, can you tell us when we expect this long-awaited project to begin?
I thank the member, although I think she's travelled far from Ballymoney in regards to her supplementary. But I do thank her for raising what is another positive development and announcement that has been made by my department and the Western Trust in regards to the progress of this work. It has been long awaited, long asked for by many political representatives across the board, including my party colleague Rosemary Barton as well. The member will be aware there's been a press release has been published in regards which actually sets out the timeline. I don't have those details, and I apologise to her, I don't have those details in front of me because it wasn't a supplementary I was expecting on the Robinson, but I will get back to the member in writing.
Just another example of a wily new member. Daniel McCrossan.
Mr. Speaker, question 5, Minister.
I thank the member. When the special recognition payment was developed, I specifically requested that this scheme be extended to include agency workers on longer-term placements. I didn't have to do this, but I did. The intention was to reward those on temporary contracts whose contributions are equally valued. The eligibility criteria for this are the individual workers must be covering one post for a period of 12 weeks or more, and on a salary commensurate with the role being covered. The 12-week qualifying period adopts the same principle established under employment law for equal treatment for agency workers. And I'm sure the member will agree that there should be no prioritisation of some staff working arrangements over others. While it is appreciated that some individual agency workers may not meet the qualifying criteria, The design of the scheme reflects my intention to recognise the contribution of those agency workers on longer-term placements. The inclusion of ad hoc shifts would also introduce a significant risk of double payment to individuals, as many employees will work a full-time contract under HSC employment and pick up additional shifts through agency working.
That ends period for listed questions, and we now move on to 15 minutes of topical questions, and I call Claire Bailey.
Thank you, Speaker. Minister, during the previous question time, I listened to members on the DUP benches beside you there claim that later today we will debate the most controversial and far-reaching healthcare regulations to date. But maybe they've just forgot that tomorrow we're due to debate a bill brought by themselves, supported by many in this House, that seeks to legislate for healthcare restrictions that have actually found to be constituting violence against women and a breach of our human rights. Minister, if that bill passes, how will that impact on your office?
I thank the member in regards to the specific question in regards to the private members bill that is proceeding through the House. And she will be aware that the Abortion and Services Direction 2021, which came into force on the 23rd of July, will require the Department to have commissioned abortion services in place by the 31st of March 2021, in line with the 2020 regulations. In regards to the outworking of the legislation that is currently being brought through that private members bill, I have indicated to the Executive before I can bring any further papers to them, I need to see the outworkings of that legislation in regards to how it may impact any commissioning of services that my department may deem to be necessary to meet the direction of 2021.
Supplementary, Claire Bailey.
Thank you. Well, further to that, Minister, can you give us an update to the House on how far progressed the commissioning of those services is?
I have indicated to Executive colleagues that I do intend to bring a paper to them in the new year. I've also informed the Secretary of State that that will be my intention in regards to the work that is ongoing, in regards to the duty placed on us to meet the directions that have been laid on us under the 2021 direction as laid by the Secretary of State.
Tom Buchanan.
Thank you. Minister, waiting lists within your department is a very, very hot topic and quite a number of areas. And if we look at orthopaedic surgery, there's a huge waiting list there. Some people are being told to have to wait for years before they can get their surgery. What steps are you taking to address this particular issue?
And I think the member, and like him as a constituent MLA, he'll be well aware that the extensive waiting list for orthopaedic surgery especially actually predated the pandemic as well, because there was a challenge. The member will be aware that in June of this year I published the elective care strategy, which sets out a number of strands where I hope that with the financial support, with political backing, that we in a 5-year period we should get those waiting lists down to a minimum of 1 year. Now that takes extensive input, not just in our own in-house capacity, but also utilising the independent sector, but also cross-border initiatives as well. So there's a number of procedures and a number of pathways already established and published under the elective care strategy that was published in June of this year.
Tom Buchanan, supplementary.
Thank you, Minister, and indeed that is welcome, where it's going to be a target of 1 year. But when are we really actually going to see that in action, that these are reduced? You know, are we going to be 2 or 3 years down the line before we can see that this is actually working and the waiting lists are now reduced to 1 year?
As I said to the member, it will take, I think, the entirety of that 5 years to get us to that point. There will be a number of waypoints where we will actually assess the success of those each different initiatives, but the member will be aware that my department publishes regularly waiting lists across all sectors, so that members have the ability and the general public has the ability to see the direction of travel. It's unfortunate that I think that due to the action of some that we are still seeing steps that could be taken to actually reduce COVID pressures not being brought into full forbearance, and there's still opposition to that, where actually we could alleviate more of the pressures that our health services are currently under, and we could see more of that normal day-to-day work actually taking place.
Jim Allister.
I want to return to the issue about the agency workers that Mr McCrossan raised. Surely there's an inherent unfairness for many agency workers who have worked full-time in the health service, but because they haven't been in the same post for the 12 weeks, because they've been going to where they've been sent in different wards, etc., suddenly, though they've put in the same effort and the same work, they are denied the £500. How could that be fair?
And I think the member will refer him actually to the answer I gave to Mr McCrossan in regards to the criteria that was actually established in regards to how that has been set. It's not new. It has been published since the very beginning, so agencies would have been aware of that. The criteria in relation to eligibility for the scheme includes which healthcare workers are available. The special recognition payment is being made pro rata for work undertaken on behalf of the health and social care, and in regards to the work that needs to be done as well as regards to the specialists there. Payments to staff in the independent sector are going to be taken forward in 2 phases. The first phase will see payments made to eligible staff and care, and further work is ongoing to finalise arrangements to deliver the payment in the second phase to the remaining categories of the independent sector, which will include personal assistants as well as those employed directly through payments. Details of phase 2 will be communicated shortly.
Jim Allister, supplementary.
The question, Minister, for you to answer is, why were such unfair criteria set in respect of some agency workers? And can you tell the House how many agency workers have been included in the £500 payment and how many, in consequence, have been excluded?
I thank the member for that question. He will be aware, I'm sure, through the communication that he's talking about, that process of agency workers still has to be come forward. As I said, it comes forward under phase 2. But what I can tell the member is that those who work in care homes and domiciliary care homes, 15,737, have already had their payments processed and approved. That's the equivalent of over £9 million actually being processed and paid to those, and that's coming from 307 applications. From those applications that have come forward from our GPs, community pharmacy, out of hours, contractors, 1,408 of those have been applications have been approved, and that's the equivalent of another £10 million payment actually getting in as well. The agency workers the agency organisations were written to on the 5th of November, and the deadline for their applications is actually the 31st of December. So they still have another 2 to 3 weeks to put in applications and processes before that actually closes.
Nicole William Urban.
Thank you, and can I thank the Minister for his responses and answers so far. Minister, you are aware of concerns around waiting times for various surgical procedures and the impact the delays are having directly on people's lives. Can you give me an update on the waiting times for cataract surgery? I was previously informed that this was a 4-year wait, and for someone who has their sight impaired and has to wait so long, you'll understand the impact of that. What plans has the Minister got to address this lengthy waiting list?
And I think the member, unlike his colleague, Mr Buchanan, actually raised in regards to orthopaedics, I'll refer the member back to the elective care strategy that was actually published in June of this year, because it does actually mention a number of mega clinics. Some of those have been actually in regards to cataracts as well, and again about how we can actually look at one-stop shops of the larger numbers actually coming through. The member will be aware as well that we undertake quite extensive piece of cataract work through the independent sector as well. So it is about how we challenge each of our waiting lists in regards to meeting the needs of those patients as well. I don't have a specific in regards to the number of cataracts on waiting lists, where they are and how long they are with me, but I'll get back to the member in writing with that.
Supplementary, William Urban.
I thank the Minister for his response. The Minister has to accept that 4 years to wait if one's sight is impaired badly. Having to wait 4 years is totally unacceptable, and there has to be a way found to get this sorted.
No, I do agree, and that's why we concentrated on publishing the elective care strategy in June, and also asked for the funding to go alongside it, and that was part of the bid that my department actually made in regards to where we're doing the preparation work for the forthcoming budget process, in regards to the work that needed to be invested in, the work that needed to be done to actually redress the 10 years of underinvestment in our health service that actually saw those waiting lists actually increase prior to COVID. So the problems that we're facing, the waiting lists that we're trying to challenge and bring down, aren't due solely because of COVID, but due to the 10 years underinvestment in our health service.
Call Millis McHugh.
Margaret Concordia. Minister, COVID status certificates are currently being issued to applicants aged over 18. Do you plan to introduce for under 18s in order to allow families with younger members to access venues where they are required?
I thank the member for his question. A member or an under 18-year-old attending any venue does not need COVID certification at this point in time. Where they may require it is actually travelling to a foreign country for a holiday purpose, where the country requires them to have it. There is an application process. If the member goes on to the Department's website and follows the Northern Ireland Direct link in regards to how they can apply for COVID certification, they will be able to access that. But at this minute in time, under the current regulations, there's no requirement for anybody under 18 actually producing that certification.
Next member is not in their place, and I now call Stuart Dixon.
Thank you very much, Mr. Speaker. Minister, you recently told me in an answer that your department had spent some £4.5 million on refurbishing White Abbey Hospital. Can you tell the House what the future plans are for that facility?
I thank the member for his question, and I'm sure I'll come back to Mr McHugh supplementary.
Yes, again, my apologies. I'm just jumping way ahead of myself. So.
But in answer to Mr Dixon, there is actually a specific task and finish group that's looking about the future proofing of White Abbey and what we can utilise that facility for. And the member will be aware it did look a number of years ago that the White Abbey was actually to be mothballed. But as I've said and consistently said, we need every square foot of our estate to actually support the people that we need to do. So while there's a number of avenues actually looking to what it can be used for. Post-COVID, it's been used for rehabilitation, it can be used for orthopaedics, it can be used for a wide range of services, even day procedures, where we look to see if we can do something similar that Lagan Valley has actually been utilised for. So there's a wide scale of, I suppose, bids and options about what White Abbey could be and will be post-COVID, but we have to get there first.
Supplementary, Stuart, may as well finish this one.
Thank you very much, Mr. Speaker. And thank the Minister for the answer to the question. Minister, you've indicated, and we are aware, that the hospital is currently used as a post-COVID recovery centre. How many patients have actually benefited from that service?
Again, I don't have detailed numbers with me to date, but I'll get them to the member in writing. One of the things was post-COVID recovery service. One of the main advantages that we actually did when we opened the White Abbey was allied health professional and nurse led. So we were seeing quite a number of patients coming through that support as well, while other trusts were actually sending them there to ease the pressures that they were facing as well. But as for the specific numbers, I don't have that with me, but I'll get back to the member.
And supplementary, William Q.
Margaret Concordia. Minister, will you agree that the use of the certificates is critically important, so it should be accessible and their use made as simple as possible? Will the rollout of the programme be subject to review to ensure improvements are identified and applied?
I thank the member for his point, and it is an ongoing review process that we do have in regards to the issuing of certificates as well, and especially for those under 18 in engagement with the Children's Commissioner as well, to make sure we make everything as easy, as accessible and as child-friendly to those who have to utilise them and download them as well. But as I'm sure the member will be aware, there's some of those in the under 18 category would find it easier than he or I would be in actually downloading and utilising it as well. So it's making sure that we utilise them in the venues where they may be applicable, should they be applicable, but also making sure they're applicable for those people who want them and need them for international travel.
And the members, Pat Catney, Ciara Ferguson and Keith Buchanan, are not in their places, so on that basis, time for the Health Minister is up. And members, please take their ease for a few moments.